Most people think there are only a few dental specialties, but there are actually 12 officially recognized dental specialties, and cosmetic dentistry is not one of them. But they all have different lifestyles, training lengths, and salaries. In this video, I'm gonna break down all 12 dental specialties from highest paid to lowest, because I know you all care about money. And I'm gonna explain what each one actually does to help you figure out which path is right for you. Now, disclaimer, I personally don't think you should get into dentistry or any of the specialties for money. There are much better ways in the world to make money and a lot better ways to get an education without incurring so much debt. If you're interested in dentistry, you should truly do it because you care about taking care of people and you're truly interested in being a dentist or a dental specialist. Now, let's get into the video. So quick disclaimer, these are average US salaries. Your income in dentistry can vary a lot depending on practice ownership, location, and the mix of procedures that you do, even as a specialist. But this ranking list will give you the most big picture comparison that I could possibly give you. So without further ado, let's talk about all 12 dental specialties from highest paid to lowest. Now, before I start, if you're new to the channel, my name is Dr. Eli. I am a first-year orthodontics resident, and I just graduated from dental school in May of 2025. On this channel, I make videos with advice for pre-dental students, vlogs of my dental school journey, vlogs of my residency journey, and things like that. So if that's what interests you, please make sure you subscribe. Now, coming in at number 12, we're not gonna start with number 1. The lowest paid, on average, dental specialty out there is dental public health, with an average salary of $120 to $180K. Now, this specialty focuses on community level prevention, not individual treatment. Think about public policy, think about community programs, think about access to care. These people have a huge impact. And one of the benefits of being a specialist in dental public health is that you qualify for the NHSC scholarship. So for those that don't know what the NHSC scholarship is, this isn't the video for that, but if you're interested in learning about it, I made a video with my classmate, first year of dental school, that I'll link right here, where we talked about what the NHSC scholarship is, what your opportunities are with that scholarship, and how it can help you go to dental school for free. Now, the next is oral and maxillofacial pathology. Now, these salaries average from $160 to $230K, and these are the people that detect disease in dentistry. Think about oral cancer, different oral lesions, think about biopsying lesions and sending it to this person right here. A lot of these specialists work on lab-based things and less patient-facing things, but they're really important for dentistry because pathology is hard. One thing can look like 5 different oral pathologies, and we need these specialists, especially when someone walks into your office and you see a lesion and you don't really know what it is. Coming in next, we have oral and maxillofacial radiology with a similar salary of $170 to $240K. These people interpret your imaging, CBCTs, panoramic x-rays, things like that. As a dentist, when you take any x-ray, you are responsible for analyzing that radiograph. Any pathology, any anomalies, things like that is your job to catch. If you take a radiograph and you don't catch it, you are being negligent. So if you see something and you're not sure what it is, you send it to an oral maxillofacial radiologist and they can help you out. They're lifesavers just like the pathologists are.
Quick intermission to the video. If you're watching the video and you've made it this far and you're enjoying the content, please drop a like on the video. It's right here under the video. Just click the little thumbs up button. It's of no cost to you and it does so much to help boost the video and the channel in the YouTube algorithm. Thank you so much, and I hope you enjoy the rest of the video.
Next, you have oral facial pain. These people treat TMJ disorder, chronic pain, neuropathic pain, things like that. Now, there's speculation about who exactly is the specialist to go to when you have TMD, temporomandibular disorders. Oral facial pain, those are the people that can help you the most. However, in my orthodontics residency, we get training on how to deal with TMD. You get training in AGD on how to deal with TMD and so forth. Next, you have oral medicine. These salaries range from $200 to $260K on average. This is kind of like the medical side of dentistry. They manage complications from systemic diseases, chronic infections, medically compromised patients, things like that. I don't know too much about oral medicine and people that specialize in it, but Shout out to all of them. Next, according to this list I'm looking at, is endodontics with a range of 230 to 300K. Now, keep in mind, these are averages. I personally know endodontists that make a lot more than this, but these are your root canal specialists. They focus on all things inside the tooth. Now, being an endodontist can be very lucrative, especially as you build your speed, as you build your patient base. Think about it. General dentists are trained to do root canals, but they're not always very fast or efficient at doing them. And they may refer their root canals out if it's gonna take them 3 hours to do something, whereas they can get paid a lot more in 3 hours doing 4 or 5 different things. Endodontists are usually also the people that see retreats, they see abscesses from pulpal disorders, things like that. Next, you have pediatric dentistry coming in at number 6. These are the people that specialize in all things kids. Now, keep in mind, when you think about specializing in pediatric dentistry, you may think, oh, I love kids. Kids are the best. Well, the good kids stay with the general dentist. The ones that are hard to manage are the ones that the general dentist refer to peds. Personally, as an orthodontist, I never really sat back and thought about how much I would be dealing with a pediatric population. But personally, I love kids. Working with kids is great, especially teenagers, because they're just growing into themselves. They're starting to develop such a personality. And as long as you keep yourself young, you can relate to them. Now, next you have periodontics coming in at number 5. These are your gum specialists. In my opinion, one of the hardest specialties out there. They deal with gum disease, they deal with bone loss, they deal with implants, they deal with all those things. But a lot of the people I know that specialize in perio like that they are able to care for a patient over long periods of time and kind of nurse their gums back to health. I've seen periodontists do some amazing things and really regenerate someone's bone and gum health. So shout out to all the periodontists out there. Shout out to Dr. Aris Davis. Now, one of the reasons periodontists are very highly paid is because these are like your number 1 implant specialists. Oral surgeons are like the implant specialists as well, but there's going to be a debate about this. If I'm going to send an implant out, I'm probably going to send it to perio first. Now, coming in at number 4, and this kind of shocked me, orthodontics and dentofacial orthopedics. I thought we were going to be higher on the list. There's still some specialties that I haven't said yet that surprisingly beat us out. Now, y'all watch my channel, and if you haven't, you know what orthodontics is. These are your people that specialize in braces, Invisalign, correcting your bite, aligning your teeth, all that good stuff. It's the best specialty in the world, and I'm not saying that out of bias, I'm saying it out of realness. Now this, as many know, is one of the most competitive specialties to get into. A lot of people want to be orthodontists or come into dental school thinking they want to be orthodontists. And trust me, I've learned it's competitive for a reason. It's very profitable. It allows a great quality of life, and there's a lot of earning potential. But boy, oh boy, do you have to be smart to be an orthodontist. You sure do. Next, this one beat us out, and I'm not gonna lie, I was low-key surprised. Coming in at number 3, you have prosthodontists with an average salary of $330 to $360K. Now, these people specialize in full mouth restorations, all on X implant restorations, full mouth veneers, things like that, your prosthetics of dentistry. Now, prosthodontists are lifesavers too, just like periodontists are. I've seen prosthodontists work full mouth rehabilitations that really restore someone's confidence, their aesthetics, everything. You can even restore someone's facial aesthetics with prosthodontics. Now, I think one of the reasons why prosthodontics beat us out is because in this new day and age, we are really starting to move more towards the veneers and the cosmetic dentistry. And to be honest, your prosthodontists are your real cosmetic dentists. These are the people that specialize in these veneers and these crowns and these full mouth rehabilitation, all on X cases and things like that. These are the specialists right here. And although I was surprised that they beat us out a little bit, hey, it's well deserved. Prosthodontists sure are magicians. Shout out to all the prosthodontists out there. Now at number 2, and I was surprised this wasn't number 1. At number 2, you have oral maxillofacial surgery with an average salary of $350 to $370K. Now these people are known for being the wisdom tooth specialist, but that doesn't even scratch the surface of what an oral maxillofacial surgeon does. These people do orthodontic surgery, they do TMJ surgery, they do facial trauma reconstruction. These are the people that are in the ER doing everything that deal with hands, face, and teeth, working with the ENT, working with the plastic surgeon. They get paid, and it's for a good reason. Now, you can go the 4-year or the 6-year route when it comes to becoming an oral maxillofacial surgeon. 6-year route goes to 2 years of medical school and gets an MD. 4-year route just goes straight through their training and become an oral maxillofacial surgeon. The difference between the two, from what I've heard, is going the MD route kind of puts you in a good realm for applying to fellowships and doing certain things in that space, but it really is no difference as far as practicing what you can do with the 4-year route and the 6-year route. Now, coming in at number 1, this is probably the most competitive specialty out there, and I'm not saying it because everyone wants to be one, but I'm saying it because last time I checked, there's only 12 programs in the entire country, and that's dental anesthesiology. Dental anesthesiology is the number 1 highest paid dental specialty out there, with an average salary of $350 to $390K. Now, dental anesthesiologists specialize in managing pain and anxiety, especially in hospital setting dentistry or in oral surgery offices. So think about your surgical cases, think about your pediatric and special needs patients. You may have a dental anesthesiologist that rotates around many offices in the state and helps them on certain days with all of their cases that require anesthesia. Now, like I said, there's only 12 programs in the country, and I think they only take 1, 2, maybe some of them take 3 residents per year, but it's not much. And as a result, there are not many dental anesthesiologists out there, which makes them highly valuable and highly paid. So keep in mind some of the things when you're thinking about specializing in dentistry and what specialties you may want to pursue. The more rare you are, the higher you get paid. If there's less of you, there's more money to go around to the less population of specialists. The more procedures you learn how to do, the more experience you get, the higher you get paid. In dentistry, a lot of things are related to your skill and your speed. So the better you get and the older you get and the wiser you get, the more earning potential you have. Number 3, as you saw me mention, not all specialties are clinic-based. You may be more lab-facing than patient-facing or community-facing, and that's okay. There are different specialties out there, and I want to encourage you all to open your minds when it comes to exploring these different dental specialties. Last but not least, those higher paying specialties like OMFS and dental anesthesiology often come with longer training, hospital-based training, longer hours, things you got to deal with. So think about it. If you're doing it for the money, you're really going to have to endure a lot. So really be in it because you want to do it, not for the money, because the road to get there will not be easy. So thank you all for watching. I hope you learned something from this video or got some more insight to the different dental specialties out there. Please make sure you subscribe, share the channel with anyone who may find it interesting, and I hope to see you guys in the next video. Thanks everyone for watching. Peace.
I got baguettes in the back of my ring, and I went he trying to hit. I told her she gotta run to the team before she can talk to the lit. Before she can talk to the yeah. Lamb chop, I just pulled up in some food.